Hi guys, this is Dr. Pangelinan, and in this lecture I'm going to talk about autism spectrum disorder. At the end of this lecture, students will understand the types and characteristics of autism spectrum disorder. You will know the appropriate terms when describing or talking to autistic individuals, and you'll become knowledgeable about the supports used to teach those with autism spectrum disorder. The Centers for Disease Control, or the CDC, defines autism spectrum disorder as a developmental disability that causes significant social communication and behavioral challenges. These difficulties interfere with social, emotional, and communication skills and can include things like young children not pointing at objects or looking where someone is pointing. Someone with ASD may avoid eye contact. They may also have sensory sensitivities to loud noises or physical touch, or on the other end of the spectrum could be called sensory seeking, where they like to spin, rock, or jump. People with autism may also have repetitive or restrictive language. For example, they might repeat the same word or phrase over and over again. They may echo what you say or what they hear in a movie or song word for word. And they might make repetitive movements like jumping, rocking, or snapping. These different behaviors can interfere with the ability to do different types of behavioral tasks and engage in typical social behaviors. ASD is typically diagnosed between the ages of 2 and 3 by a physician, psychologist, or early intervention specialist. ASD occurs 4 times more often in boys than girls. Physicians and parents are becoming more knowledgeable about and identifying early characteristics of ASD. There are 4 early signs of ASD that provide a clinician or parent with an indication there may be signs of ASD. First, avoiding eye contact. A child won't look at you in the eye directly. Second, having very little interest in other children or other caregivers. The child may play on his or her own and may not be interested in playing with other kids. Third, limited language skills. This includes difficulty communicating their needs or understanding language from other people. Fourth, getting upset by minor changes in routine. Children with autism tend to like routines and schedules, which help them know what's expected of them. A change in the routine may cause a child to have an emotional meltdown, especially if the child has difficulty communicating his or her needs. As a child gets older, deficits in social communication and interactions with individuals across multiple contexts, like at home, school, or at play, may become more apparent. Again, restrictive or repetitive patterns of behaviors, interests, or activities may become apparent. For example, fixation on categories of objects like cars, things that are mechanical, Disney movies. And as mentioned, the criteria for ASD must be observed early during development, and oftentimes children are diagnosed by ages 2 or 3. In addition, the symptoms have to be clinically significant, meaning that these symptoms really affect the child's ability to interact with others. Importantly, ASD is not caused by an intellectual disability or global delay, but some individuals with ASD can also have intellectual disability or global delay. If a child has been diagnosed with intellectual disability or global delay, they can also be diagnosed with ASD, but the symptoms of ASD must be beyond what we would expect for an individual with intellectual disability or global delay. What I mean by this is that some children with intellectual disability might have speech or language difficulties, but these difficulties don't usually affect their social interactions with caregivers or other kids, their emotional regulation, or other behaviors. So in order for a child with intellectual disability to also get an ASD diagnosis, their difficulties must affect their social, emotional, and behavioral development beyond what is typical of the difficulties expected for a child with intellectual disability. The figure on the right here shows the 3 different functional levels of autism. Level 1 requires some support, but their symptoms don't interfere too much with their work, school, or relationships. The individual might have difficulty initiating or maintaining social interactions, organizing and planning their behaviors, and may show some restrictive interests. These individuals might need a little bit of help to gain additional independence. They're likely to complete a regular high school degree or advanced degree, have a job, and live independently as an adult. Level 2 requires substantial support. They require outside support on a daily basis, which may include speech therapy, social skills training, and occupational therapy. For these individuals, their social interactions may be very limited. These individuals may understand what others are saying to them, which is called receptive communication, and they may be able to verbally express their needs, thoughts, so forth. However, these aspects of communication could be affected in those that exhibit level 2. They may also show more restrictive and repetitive behaviors like rocking, spinning, or repeating specific words and phrases. But overall, they're able to complete most tasks independently with limited support. Depending on the individual's level of intellectual ability, someone that's considered to be level 2 may still be able to complete a regular high school degree with the help of an aide. Level 3 requires very substantial support on a daily basis. This includes full-time aides at school, intensive therapy, and support from caretakers at home. These individuals have significant problems in verbal and nonverbal communication and social skills. They may exhibit problem behaviors or stress when they have to transition from one activity to the next. They may need an alternative form of communication device to help them communicate. These individuals tend to be in a self-contained classroom at school and tend not to be in an inclusive classroom environment. So they are much more limited in how much they interact with their typically developing peers. With this said, in our adapted exercise and sport programs, we've been able to teach individuals with ASD that are level 3 how to swim, play soccer, play tennis, and do Zumba. We just provide a lot of behavioral supports to enable them to participate, and we let them participate at their own pace. There are many causes of autism. However, one thing that we know autism is not caused by is vaccine exposure. There's a lot of research to provide evidence that vaccines do not cause autism. However, this misconception is still perpetuated in the public. Autism is likely caused by a combination of environmental, biological, and genetic factors. And we know that there are some genes that may increase the risk of autism and some genetic disorders, like Fragile X syndrome, that have characteristics consistent with autism. We know that if you have a parent or sibling with autism, you have an increased risk of autism, which can be up to 50% increased risk. If you're given certain prescriptions or exposed to other types of drugs during prenatal development, this can also increase the risk of autism. Similar to intellectual disability and Down syndrome, children born to older parents may also have increased risk of autism, which may be due to an increased risk of genetic and prenatal issues that are common in older parents. Okay, so on Canvas, I've posted this YouTube video that interviews people that are autistic and talks about their experiences living with autism. I love this video because you're able to see the range of individuals with ASD and hear in their own words what might be helpful for others to know about ASD. It's important to note that most of the individuals in this video would be considered level 1 or level 2 because they have very good expressive communication. Let's transition to talking about the kinds of behavioral supports that are useful when teaching motor skills to people with ASD. As I mentioned in the lecture on intellectual disability and Down syndrome, visual supports include images with simple instructions. We rely very heavily on visual supports, especially for those that need substantial support, like those that are level 2 or level 3. On the next slide, I will show you an example of a task card created by the Special Olympics Young Athletes program and how I modified it to create a picture schedule. Visual supports like task cards and visual schedules help participants know when they've completed a task and when they need to move on or transition to the next task. And this reduces the stress or resistance that may occur when moving from one task to another. Verbal supports are really helpful for those with limited receptive communication, meaning they have difficulty understanding what you're saying to them or understanding the instructions you're trying to give. In our programs, we often use a combination of visual supports with simple verbal cues to help communicate instructions for a task. Here's an example of a task card from Special Olympics Young Athletes for Week 1, Day 1, Foundational Skills. The task card provides a lot of information: the equipment, the order and timing for each task, and the location of additional resources. Although this is useful for instructors and coaches, this might be too much information for someone with ASD. So on the right, I translated the information on the task card and created a picture schedule. There's a checkbox for each task and a picture of each task taken from the manual. In our programs, I create a picture schedule for each participant, laminate it, and then the participant uses a dry erase marker to check off each task after they complete it. We'll then review with them the next activity so they know what to expect. In addition to visual and verbal supports, we can also use physical assistance to help participants with ASD learn and perform different motor skills. Live demonstrations are useful so that the participant can see the whole movement sequence, but someone with autism might not be able to pay attention to a live demonstration. So we might actually record a demonstration and play the video of the task to the participant. One of the reasons why I love the Special Olympics Young Athletes program is that there are really nice videos for all the games and activities, so I can show a participant with ASD the video, which they might prefer to a live demonstration, and also provide live demonstrations. Another form of physical assistance is providing hand-over-hand instruction. As I described in my lecture on intellectual disabilities and Down syndrome, move the participant's hand or body to perform a task and let them practice that task independently. Hand-over-hand instruction is only done when participant has not initiated the task by his or herself or seems to have difficulty performing the movement sequence. We also use task modifications like adjusting the time, the strength, and the coordination, and the instructions to complete the task. This is helpful to meet the needs of each individual. We can make a task easier or more difficult to enable a participant to progress at their own pace. The general approach we use when working with people with autism and disabilities in general is what's called least to most support. What I mean by this is that we first provide simple visual and verbal supports. If the participant still doesn't understand the task or has difficulty performing the task, then we might add a demonstration, either a live demonstration or a video. If the participant still can't perform the task, then we may add hand-over-hand instruction. However, we don't typically provide hand-over-hand instruction unless the other supports don't help the participant. The goal of this approach is to enable the greatest independent performance. And this doesn't mean that the participants perform the task perfectly. We let them perform the task to the best of their ability and add supports when they are needed to improve specific components of the skill. Okay, on Canvas, there are 2 videos about autism that you'll need to watch for your quiz. The video I mentioned earlier, in which people that are autistic talk about their experiences, and another video from Duke University that describes the characteristics of autism spectrum disorder. Please let me know if you have any questions about the material, and I'm happy to provide additional assistance.